My name is Lindsay Fenwick. I'm going to be your nurse practitioner today. Can you please give me your name and your date of birth?
Brenda Chavarria, and my birthday is 4/20/1977.
Perfect. And it's sounds like today you're here. We're going to take a look at your respiratory status, your heart, abdominal, and then your peripheral vascular system. So just general appearance, looking at you, your skin is nice and pink. I don't see any bluing around your lips. Looks like you have good blood flow to your hands here. Get a set of vital signs on you. We'll check your blood pressure, your temperature, your oxygen level, and your heart rate. Okay. Once we're done with that, then we'll move on to the respiratory. Okay. So just looking at you in general, inspecting you, it looks like you're not labored with any of your breathing. I don't hear any wheezing audibly with just standing here. It looks like your expansion is symmetric. You're not using any accessory muscles, or it doesn't look like you're visibly struggling to breathe at all. Do you have any reports of shortness of breath?
No.
Good. Looking at your trachea, it does look like it's midline, no deviations. Looking at the area here between your trachea and your sternomastoid, and the areas between that, just going to palpate here. They're both symmetrical. Okay. We're looking for your rate and rhythm as well. So it appears here just by looking at you, you're breathing about 16 to 18 breaths per minute, which is normal. Typical breaths are 16 to 20. Anything below or over 20 would be respiratory distress. So we're going to begin by just inspecting as well. So looking for any deformities within your thorax. So I would have you gown, so I would be able to have a better assessment of your skin, and that would provide more flexibility for me to see if you have any abnormalities. So looking from you from the front here, it looks like everything is symmetrical from one side to the other, and coming to the side, looking laterally and then posteriorly as well. Everything appears symmetric here. It doesn't look like there's any deformities. It's like a 1 to 2 exposure that you have, meaning that that is how we like to see your the frame of your body and your lung expansion. So also making sure when you're breathing, when I'm looking around, I'm looking for that chest rise and fall, and assessing for symmetry of that as well. It looks like as I was walking around, both sides are rising and falling the same, and it doesn't look like one side is more labored than the other. Okay, and next we're gonna move on to palpating. So we're gonna begin by just assessing to see if you have any points of tenderness or pain anywhere. So I'm gonna put some gloves on, hand hygiene. Wash my hands. And just visually looking at you as well, it doesn't look like you have any noted bruising anywhere to your skin either. Okay, I can't get these gloves on. I know. Okay, this is just ridiculous. Don't mind me. Okay, so I'm going to start here by palpating. I'm going to start up here. Do you have any pain or tenderness?
No.
In the thorax area here?
No.
Okay, I'm going to move down this way. Any pain or tenderness?
No.
Move to the side here. Okay, I'm going to come around. I'm just going to have you just turn this way just a touch for me. Perfect. I'm going to kind of palpate back here as well while you're breathing in and out. Any tenderness with that?
No.
Okay, now I'm going to check for chest expansion. So I'm going to place my thumbs right here by your spine and right below your scapulas. And can you go ahead and take a deep breath? and breathe out. Perfect. And one more time. And breathe out. Good. Very good. So rises and falls symmetrically. No issues with that. So now I'm going to check for the tactile firmitis. So what I'm going to do is I'm going to place my hands up here and I'm going to have you say 99. Okay?
99.
Good.
99.
Good.
99.
Good.
99.
Good.
99. 99.
Good. Okay. Perfect. I'll have you swing back around here. And that what I'm checking for with that is just making sure that the sound is vibrating the same through both sides of the lungs, and we're not feeling for like areas of dullness, that it feels the same on both sides. Okay. So next what we're going to do is we're going to percuss over your lungs too. We're looking for any areas of dullness or resonance. So just checking for if there's possibly any fluid that may be in your lungs or any areas of pockets that may be filled with other areas of fluid. Okay, so I'm going to start up here. Come down here. Okay. I'm going to come over to this side now. And not feeling any pain with any of this either?
No, not at all.
Good. Okay, and I'm going to come over to this side as well and do it on this side. Sorry. You're okay. Good. I'm gonna come over on this side. Very good. And on this side over here. Okay. And now what I'm going to do is I'm going to check for your diaphragm here. So looking for the level of the diaphragm, and it's just the same thing. I'm going to have you first take a deep breath in and hold it. Okay. Okay, you can go ahead and breathe. And now what I'm going to have you do is take a deep breath in and release it and hold it while you release, okay? You can go ahead. Okay, so I'm marking those areas there. So it looks like it's about 3.5 to 4 centimeters, which is normal for that expansion of the diaphragm. And now I'm going to go to the other side and do the same thing, okay? So I'm going to have you take a deep breath in and hold. Okay, so there's that line there. And then you can go ahead and breathe. And then I'm going to have you take a deep breath in and release and hold. Okay, perfect. So again, it's about 3.5 centimeters there. Okay. All right, you can swing back around. Okay. Okay, and now we're going to move on to listening to your lungs, okay? So, all right, I'm going to have you take a deep breath in and exhale. And of course, I would be listening skin to skin here. I'm going to come under here. Good. Good. All right, I'm going to come over to this side. Take a nice deep breath. Good. Good. Okay. And then I'm going to check for, I'm going to have you take a couple of coughs. And I'm going to listen to you. I'm going to be checking for any cracks, crackles, or wheezes, or any coarseness, okay?
Okay.
So, all right. Go ahead and take a cough. Good. And again. And again. And again. Okay. and now I'm gonna do, these are some special tests that we have. It's called bronchoscopy. No, that's wrong. Bron, bronchophony. I can't say these. Whispered pectorality and egophony. Okay, so the first one we're gonna do is I'm gonna listen and you're gonna say 99.
99, 99, 99, 99, 99, 99.
Okay, and then you're gonna say E.
E, 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 E.
Good. And then I'm gonna have you whisper 99. Okay, good. All right. So I'm listening for your pitch, your intensity. I didn't notice any crackles or wheezes, any areas of coarseness. I could hear the full lung expansion throughout all of your lobes. So the only other thing left that we have to do is just have me take a deep breath through your mouth and then exhale with your mouth open. Good. And one more time. Perfect. All right. Do you have any questions for me about the respiratory?
No.
Okay. There's the pause. Okay, so now we're going to move on to the cardiac portion of the assessment. So again, noting your general appearance. I don't see any cyanosis around your lips. Eyeballs have good color. Your skin tone is nice and pink and warm. Take another set of vital signs. Maybe at the beginning of the assessment. To begin, we're going to look at your carotids. So I'm checking for pulsation, checking one side at a time here. Nice strong pulsation. I'm checking for palpating to see how the amplitude is, feeling for any thrills or if they're bounding, making sure that they feel the same on both sides, which they do. I'm going to take a listen and just listen for bruise. So I'm going to have you hold your breath. Okay, you can breathe. And then I'll check this side. Hold your breath. Okay, good. No bruise. And then I'm going to inspect for jugular vein distension and the pressure that you have there, so, or pulsation. So I'm going to have you just slightly turn your head that way.
Do you want me to lay down?
Yeah, I will in just a moment. Yep. And then I'll have you look that way. Perfect. Okay, and so now I'm going to have you lay back down here. Help you here. Perfect. And I'm just going to move the camera a little bit. Okay, so now what I'm going to do is I am going to inspect for your jugular vein distension. So I'm going to have you turn your head slightly that way. Coming to the mid-sternal here. And looking for the highest maximum point here and going even. And you are at, looks like about 1.5. So that's good. Anything below 4 centimeters is what we're looking for on that. Okay. Next, we're going to check your PMI. So I am looking, that's your point of maximum impulse. So I'm going to be going to the 4th, 5th inner midclavicular intercostal space here. Just inspecting for any abnormal pulsations here. So you're going to feel me touching you here. And I actually can palpate it there. The pulse is regular rhythm. It doesn't feel like it's bounding at all. I'm palpating for the location of it, the amplitude. It is small and gentle. and the duration. There's no double pulses of that. If I wasn't able to palpate it, I would have you turn to your left side. I guess we can do that if you want. I don't know. Yeah, I'll have you turn. Okay. Yep, I'll have you turn your left side. Let me pull this out here so you have a little. Yep. Yep. And then what we would do is I would percuss that area and check to see if there's any cardiac dullness, which I don't hear at all. Okay. Perfect. And now I'm going to I'm gonna palpate your aortic, pulmonic, and systolic points here, just to check and see if there's any boundingness. If I was able to feel any bounding, that would be a sign that there's maybe some backflow or some issues with your heartbeat. Okay. So palpating there. So I'm palpating for those pulsations at the right second intercostal space. That's the aortic arch, and then the pulmonic is the left second intercostal space. And then the systolic here is the left sternal border 3, 4, and 5 intercostal space. And then what I'm going to do is I'm going to go ahead and auscultate those areas as well. So we're going to listen for the aortic, good, and the pulmonic, and Erb's point. Then we're going to the tricuspid, and then to the mitral. I'm going to be listening to the apex here, so noting the rate rhythm, seeing if there's any extra sounds, the timing, intensity of it, making sure there's S1, S2, listening for pitch, if there's any radiating areas throughout, and the quality of the pulses. And then I would, I don't have a bell on this. Maybe I should just grab yours. I'll grab this stethoscope. Okay. And then I'm going to be auscultating with the bell of the stethoscope, and going to be, I'm going to have you roll to your left side here. If you need help, let me know. And I'm going to be listening for any S3, S4s, murmurs, or mitral stenosis. Okay. Let's take a listen to you here. Okay, perfect. I don't hear any additional sounds there. All right, and then I'm going to have you sit up here. Great. And have you lean forward and exhale. So I'm going to be listening for the left sternal border here of the apex for, with the bell of the stethoscope, for any aortic murmurs there. Go ahead and exhale. Okay, and checking over at the apex. And exhale. Good. Okay. And that completes our cardiac exam. Okay, so prior to moving on to the abdominal examination, I just wanted a quick mention from the cardiac, if you did have any murmurs that were detected, we would be looking for the intensity, the timing, which location that we're hearing the murmurs at, and if it's radiating throughout any of those other areas, the pitch and quality of that as well. Okay. So hand hygiene here, moving on to the abdominal exam. So we're going to, just gonna hold up your shirt here a little bit. Initially we're just looking at inspecting. So we're looking for the symmetry of the abdomen. We are Looking for contour, if it's flat, if there's any protruding areas, if you're having any irregularities or bulges coming out in any of the abdominal quadrants, which I don't see any of that, or if it's concaved. Then we're also going to be looking for just general appearance of the skin. Do you have any scars, scabbing, bruising, rashes, lesions, any of that? And then looking at the umbilicus, so we're looking for bulging, signs of herniations, or if there's any like bruising around that area, peristalsis, if there's any irregular waves throughout, if you can see the digestion happening within your belly. And then aortic pulsations, we'd be able to see here, which would be abnormal. We don't want to see any of those, in which I don't see any of that. So next we're going to move on to auscultating. So I'll get my stethoscope here. We're going to be listening in the 4 quadrants of your abdomen. In an assessment, I would listen for a full minute in each quadrant, making sure I could hear that there's motility, listening for any like hyperactivity or hypoactiveness. So I'll go ahead and start to take a listen here. So just noting the frequency and the character of those sounds that I'm hearing. And again, in all 4 quadrants, would want to listen for a minute, making sure I can hear those sounds. I hear good motility throughout all 4 quadrants. And now I'm going to listen for any aortic bruise. So between your xiphoid and your umbilicus here. And I don't hear any bruise. Then I'm going to listen for any renal bruise. On both sides, left and right. Which I don't. And then I'm going to listen for any iliac and femoral bruise. So the iliac, I'm going to go below the umbilicus and kind of off to the side here about 2 inches. So listening on both sides there as well. For those bruise. And then in the femoral area, again, you would be in a gown, you would be exposed. I would be able to have access to these areas to be able to really also assess like the skin as well. Okay, so no bruise with that. I'm going to listen over your liver and your spleen, just listening for any venous hums or friction rubs. You know, if I had you in this exam room a while, you're probably getting hungry. All right, so no friction rubs over the liver or the spleen. So now we're going to move on to percussing your abdomen. So I'm going to do, your abdomen is kind of divided into 9 different areas here, if you will, 3 on this side, 3 in the middle, and 3 on the left side. So I'm going to percuss over all those areas, looking for any dullness. And so we'll do the abdomen, and then we're looking for tympany, dullness, and then I'm gonna measure the span of your liver and your spleen. Okay, my hands are freezing, and I'm so sorry. Okay, so I'm gonna start down here. Okay, good. And then we're going to assess for the liver span. So I'm going to do your mid-clavicular line here. So kind of right under your breast. Freezing, I'm so sorry. So I'm looking for trying to determine where your liver kind of starts and ends, and then assessing for the span of that. So I'm going to start here. About there. Yep. Okay, and then I'm going to come from the umbilicus area, same midclavicular, and come up. Kind of note that area. Okay, so the span here is about 5 to 6 centimeters there, which is normal for size. And then I'm going to come over and do the same with the spleen. We're looking for trying to assess for splenomegaly, so if there's any issues with your spleen there. So it's going to be the same. So I'm going to have you take a deep breath for me and hold. I'm just looking for that dullness. Okay, you can breathe normal. Okay. And this is on the anterior axillary line at the lowest inner space. And then I'm going to do the same down here. So take a deep breath and hold. Okay. Okay. All right. Next, what we're going to do is we're going to move to palpation. Are you having any areas of tenderness in your abdomen right now? Okay, so I'm going to start by gently palpating, and then we'll move to a deeper palpation about is it 2 inches, like 2 inches into your skin, and then we're going to check for rebound tenderness. Okay. So if you do have any areas of pain, just let me know. Just kind of moving in a smooth motion here. Looking for any masses, irregularities, bulges. And if I did, still crazy. If I did notice any masses, we would determine the consistency of them, kind of feel for a shape, how big they are, if they're hard, soft, and then do further workup if we needed to. All right, so now I'm going to start doing a deeper palpation here, so about 2 inches. Any tenderness or pain? Okay. Okay, good. So now what I'm going to do is check for some rebound tenderness. So I'm going to kind of slowly push down and release quickly, okay? Any tenderness?
Mm-hmm.
Oh, okay, perfect. Again, looking for that tenderness, any pulsations, seeing if there's any masses that were noted. And next we're going to move on to palpating your liver's edge. So I'm going to go ahead and have, cold arms here. Come over to the side here. Yep, kind of hold your arms up. So I'm going to come around to the back side of your lower rib cage and just kind of support your back here. And I'm palpating down into that liver space, kind of under your rib cage, feeling if I can feel the spleen at all, which I don't, so that's good. No spleen enlargement. And kind of the same over on this side for your spleen. I'm going to be palpating here. Can you take a deep breath for me? Good. I'm kind of hooking on both sides here. Take a deep breath for me. I'm going to do the liver here too. Okay, good. And I don't feel that. And then I'm going to palpate for your kidneys. Again, this is kind of the midclavicular line, just feeling. This is also at the liver, kind of where like the liver's edge is, in the costal margin. I'm not feeling anything, which is good. Okay. And then I'm going to assess for your aortic width here. So just coming along here, seeing if I can feel anything, if there's any bulging, checking for, aneurysms. Should be about 2 to 2 centimeters. which that feels fine. So next we're going to do some special techniques. So we're going to assess for appendicitis. And so the first thing that we're going to do is appendicitis would happen in the right side over here. So I would press down over on the left side here. And if you had any referred pain, do you have any pain? No. Okay, I'm gonna let go. That would be a sign. That's the Rovsing sign. And then the next one I'm going to do is the psoas, or psoas, I think you say it. And so that one is going to be pain during your right hip flexion. So passively right hip flexion. So I'm going to have you straighten your leg here and kind of move it out this way. Any pain that way? No. Okay. And then I'm going to do the arbitrator sign. So I'm going to flex your right hip here and move it in this way. Any pain? You would have some referred pain up here. Okay, good. The next one we're going to do is for cholecystitis. So I would assess for Murphy's sign. So your gallbladder's over on this side. So I would palpate your liver's edge and have you take a deep breath in. Very good. And if you were not able to do that, if you would have a sharp pain, that would be a positive sign for having cholecystitis. The next one we're assessing for is ascites. And so what we do for that is we would, we're testing for a shift in the fluid. So ascites is like a fluid collection here. And so what you would do is you would percuss outward and look for tympany. So we're going from like a tympany sound to a dullness sound. So kind of starting this way and percussing in and listening for that dullness, because as the fluid shifts, it will become more dull over that liver side. And then I would have you turn to your left side and then start on this side and do the same, because the fluid would shift to the other side. So percussing over until you can identify that dullness. Okay. And then the last one we're going to test for is that costovertebral angle. So I put your shirt down here. Now I can help you sit up. Perfect. So what this one does is we're going to test for, no, you're okay. Test for flank pain, kidney pain. So I'm going to put my hand above here and I'm going to do some pounding, and you let me know if you're having any pain. Okay. 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 We'll come over to this side and do the same. Any pain? No. Okay. All right. And I believe that that concludes our abdominal exam. Great. Thank you. All right. All right. So now we are going to move on to your peripheral vascular assessment. We're going to start. Oh, my hand's going to cut off here. Okay, first I'm going to start by doing a general inspection of your body here. So looking at your arms from your shoulders down to your fingertips, I would have you in your gown. So just looking for the size of your arms, assessing for symmetry, and noting if there's any swelling. And then noting the color of your skin and your nail bed. So your skin is nice and warm, pale, or pink in color, not pale. Looking at your nail beds here, I don't see any clubbing, bluish tint. You have a cap refill less than 3 seconds on all of your fingernails there. And then going to just take a general look at your veins, looking to see if there's any protruding areas, any spidering of any veins. And then we're going to do the same for your legs. And so again, I would have you in a gown. We're going to be looking anteriorly, posteriorly, and laterally at your skin. So inspecting to look and see the same as the upper. So the size, the symmetry, we're looking for any noted swelling to any areas of the body. And then we are noting the color of the skin, feeling the backs for the color or the temperature of your skin with the backs of my hands, noting the distribution of the hair that you have on your arms and your legs. Is it evenly distributed throughout? Are there any patches or balding areas? If you are missing areas of hair on your legs, it can be indicative of some autoimmune diseases, but I don't note any of that, or like a thyroid or endocrine problem. And then I'm going to be looking, I would have you stand, and I would assess for, I would assess for varicose veins. So the same, looking laterally, anteriorly, posteriorly, looking for any of those spidering of the veins, noting any pigmentations, rashes, scars. You can go ahead and have a seat. And then also assessing the soles of the feet. So looking for any blemishes, any cuts, ulcerations, anything like that. So then we're going to move on to palpating of the arms. So I'm going to start by palpating your hands are cold. Palpating your radial pulses. So we're checking both sides here, making sure that they are both equal on both sides. +2 is the blood flow that's going through. And then we're going to assess for the brachial pulses here. So that's graded from a 0 to 3, and yours are a +2 there as well. And then I'm going to have you put your arm up at a 90-degree angle, and I'm going to be looking for these, they're called epitrochlear nodes. So just kind of going between the tricep and the bicep here, assessing there, and we'll do the same on this side, 90-degree angle, assessing for that. Very good, you can go ahead and relax. And then I'm going to, again, I kind of already went through this, but checking for the cap refill on all of your fingers here, making sure the pink returns to them, nice return there, less than 3 seconds. Any numbness or tingling? No. Perfect. And then we'll go ahead and do the same for the lower extremities. So I would be looking for, I'm going to start with your femoral pulses. So I'll throw some gloves on, wash my hands again. All right, and then get these gloves on here, and I'm gonna have you actually go ahead and lay down for me, and I'll pull this out so you're not, there we go, perfect. Okay, so we're gonna start by palpating your femoral pulses. So right here in your groin here, we'll be palpating both sides, making sure again that they're even, grading those pulses, the +2. And then I would move to the popliteal. So that's going to be behind your kneecaps here. So assessing those. All right, and then we move to your posterior tibial pulses. Okay, and then your dorsalis pedis. Very good. And then when I'm assessing for your femoral pulses, I'm also looking for those inguinal nodes, checking for the shape, sizes, if there's any masses or abnormalities with those. And then while I'm palpating for those nodes, also checking, I would check the temperature of your skin without my gloves on, so, and the back of my hands, so making sure I can, you know, feel all the way around that your skin is nice and warm, you're not having any coolness, which could be an indication of peripheral vascular disease. Also looking for edema, noting any swelling, checking for pitting edema, so pushing fingers in, seeing if there's any indents in the skin with that. Checking the cap refill on all of your toes here, Again, looking for less than 3 seconds, which all those are good. Any numbness or tingling to your lower extremities?
No.
Okay, perfect. Okay, and so then I'm gonna have you sit back up here. Good. I'm gonna pop this in. Okay, so now I'm gonna do an Allen's test on you. This is a special maneuver. So I'm gonna have you go out this way. I'm gonna occlude both your arterial and your ulnar and radial arteries. So I'm gonna hold pressure here. Make a tight fist while I do that. And then I'm going to have you open your fist up. I'm gonna let go of one, and you can see the blood flow coming back. And then the other, nice and pink. Okay, and then we do the same to this side. So go ahead and make a fist. And I'm going to compress both of those. All right, and go ahead and release. And you can see the pink flowing back in and letting go on that. And the pink's flowing back there as well. And then the last test that we're going to do is testing for arterial insufficiency. I guess I should have done this while you're still laying back. I'm going to have you lay back. So, okay, so I'm going to go ahead and I'm going to have you put your legs out straight. I'll help you here at a 60-degree angle. So we're going to raise both legs until your foot starts to have some pallor in it. And after we do this, it's usually about a minute. And then we're going to...
I'm really trying here.
Okay, here. Sorry. No, it's okay. Just relax. I'll hold them up for you. Okay, and then we'll go ahead and have you sit back up and dangle your feet over. And what we're checking for is the return of the pinkness, usually within 10 seconds, filling of the veins to the feet, which you can see evidenced here, and all that blood flow into the ankle. So usually like 10 to 15 seconds. And that concludes our peripheral vascular.